Did you know that you might not need dental x-rays at every dental visit? Hi everyone, my name is Whitney and I'm a registered dental hygienist here to talk about dental x-rays. When you really need them, what types are there, and how often they should be taken according to evidence-based guidelines. Let's start by making one thing clear. Dental x-rays aren't something to skip altogether. They're essential because they help dentists detect problems that aren't visible during a regular checkup. For example, x-rays help spot things like cavities between your teeth, bone loss, gum disease, pathologies, and issues with your jaw. Again, things that aren't always visible just by looking inside of your mouth. By catching dental issues when they are small, before they are visible in your mouth, it will save you time, money, and pain. But here's the thing, just because they're important doesn't mean that everyone needs them taken every single time you go to the dentist. It really depends on a bunch of different individual factors on how often you personally need certain dental x-rays. There are a few different types of dental x-rays and each one serves a specific purpose. Let's go through them. Number one, bitewings, aka BWX. These are the most common type of dental x-ray and they are usually taken to check for cavities between your back teeth and the level of the bone and whether there's any tartar or calculus present below your gum line. Bitewings are usually recommended once a year or every 12 to 24 months depending on your risk for cavities and ongoing gingival issues. Number two, FMX, aka full mouth x-rays or a full set. This is a complete set of x-rays that shows all of your teeth, both the front teeth where you smile and the back molars. But how they are different from bitewings is that the entire portion of the tooth is in the photo. So the crown, top portion of the tooth where you chew, as well as the root portion and the surrounding bone underneath the gums. This way we can check for infections, pathologies, and all the surrounding tissues. These are typically done once every 3 to 5 years for most people. The exact frequency is determined based on your individual needs. If you are super healthy patient, no concerns, no history of cavities or gum disease, usually the 5-year mark is fine. But if you are at higher risk for dental issues, like having a lot of dental work done or signs of gum disease, they might even recommend you get them more frequently than the 3-year mark. It really just depends on your comprehensive assessment. And lastly, number 3, panoramic x-rays, aka a pan or a pano. This type of x-ray gives us a broad view of your entire mouth, including your jaw, teeth, and even sinuses. This one is great for seeing things like impacted wisdom teeth or other structural issues, before or after braces, to check your jaw, things like that. You've seen this one. It's the one that goes around your head and gets all your teeth in one image. And similar to full mouth x-rays, panoramic x-rays are usually recommended once every 3 to 5 years or as needed. However, they are usually interchangeable with one another. Like it will either be an FMX or a pan, depending on your individual needs. Overall, there are specific guidelines about how often dental x-rays should be taken. Like we said, generally once every 12 to 24 months for bitewings and once every 3 to 5 years for full mouths and or panos. But the take-home message is, it's all based on your individual risk factors. It's not a one-size-fits-all schedule. Now, some dental offices might take x-rays at every appointment or twice a year if you visit every 6 months because that's what your insurance covers. But here's the thing, just because your insurance covers it doesn't mean it's always necessary for your oral health. Sure, there are patients that need them every 6 months because we're really struggling with cavities or gum disease and trying to catch things before they get bigger. But if you have a low risk for cavities or no signs of gum disease, getting bitewing x-rays more than once a year usually isn't needed. The American Dental Association recommends that dentists tailor x-ray frequency to your individual needs, especially based on your risk of cavities, also known as a caries risk. Again, if you're not prone to decay or gum disease, you probably don't need x-rays at every single visit. But if you are someone with a history of cavities, fillings, gum disease, then more frequent x-rays might be necessary to keep an eye on things. It's all about what's best for your health, not what your insurance company covers. If you feel like you're getting way too many x-rays, talk with your dentist. There's no harm in discussing your concerns. Ask why they're recommending x-rays for you. In most cases, once a year for bitewings is the standard, but your dentist might have a good reason for suggesting otherwise, more or less. It's all about personalized care. Something we can't do, though, is have no x-rays on file for you. Without having x-rays on file, we can't properly care for your mouth. It's like asking a mechanic to fix your car, but not allowing them to open the hood to see what's wrong. I know that's not the best analogy, but I say say it because oftentimes people will say,
nothing hurts me, so I don't need x-rays. I just want a checkup and a cleaning.
But the whole point of the initial x-rays that we take is to see what your baseline is. For us to help you, we need to see what we're working with and make sure there's no pain coming soon for you. Just because none of your teeth hurt you right now doesn't mean there aren't problems brewing under your gums. X-rays are preventative, so we can catch things before they hurt you. Once something hurts in your mouth, it's probably not going to just be a simple cavity filling anymore. Once teeth start to hurt, usually it's already become a more serious issue. So our whole goal as dental professionals is to help prevent you from getting to that point, and x-rays allow us to do just that. A main reason people hesitate to get dental x-rays is because they're worried about radiation exposure. But the truth is, dental x-rays are much safer than they used to be. Thanks to advances in technology, modern digital x-rays expose you to significantly less radiation than the old film x-rays. We're talking about a reduction of about 80% of radiation exposure. To put things in perspective, the amount of radiation you get from dental x-rays is less than what you're exposed to during an airplane flight or even from just living in your house, where background radiation from things like the sun or building materials is present all the time. In short, today's dental x-rays are incredibly safe, especially when used appropriately. So when you do need x-rays, there's no need to worry about the radiation risk. I have a radiation chart on my website, teethtalkgirl.com, that gives comparisons of different daily things we get radiation from versus the small amount you get from dental x-rays. So let's recap. Dental x-rays are very important for spotting hidden problems, but most people probably don't need them at every single visit, unless you're at a high risk for cavities or gum disease. The frequency of x-rays should be based on your unique dental health, not what your insurance covers. And don't stress about the radiation because it's way safer than it used to be, and it's a lot less than just living life on Earth from the sun and so much more random radiation we get throughout the day. But if you're concerned that you're getting too many dental x-rays, next time you're at the dentist, just ask how necessary they are for you based on your individual oral health needs. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com. I will also link that radiation chart below, and you can also hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.